Hello and welcome to the channel. Today we are talking about something that could quite literally save your life or the life of someone you love very much. Heart attacks are often depicted in movies as a sudden and dramatic event where someone clutches their chest and falls to the ground. But the reality is that the human body is incredibly smart. It usually begins sending out silent distress signals days, weeks, or even a full month before a major cardiac event actually occurs. Recognizing these early warning signs is the absolute key to preventing a tragedy, yet most people completely brush them off, thinking they are just stressed, tired, or getting a little older. Today, I am going to walk you through the 7 early warning signs of a heart attack that you should never ignore. I will explain exactly why they happen so you can easily understand what is going on inside your body. Let us start with the first major warning sign, which is an overwhelming sense of unusual fatigue. Now, I am not talking about feeling tired after a long day at work or needing an extra cup of coffee because you did not sleep well the night before. This is a profound, crushing exhaustion that seems to come out of absolutely nowhere. You might find that simple tasks you do every single day, like making the bed, carrying a light bag of groceries, or walking up a small flight of stairs, suddenly leave you feeling completely wiped out. This kind of fatigue happens because your arteries are narrowing. As plaque builds up inside your blood vessels, the pathway for blood to flow to your heart becomes smaller and smaller. Your heart has to work incredibly hard to pump the same amount of blood through those narrowed vessels. Because your heart is struggling, your body redirects oxygen and energy away from your muscles and sends it to the heart to help it survive. This leaves your entire body feeling drained. Women in particular report this type of extreme fatigue weeks before a heart attack, often mistaking it for the flu or just severe stress. If you wake up feeling exhausted after a full night of sleep and that exhaustion persists for days without any clear reason, your body is begging you to pay attention. The second early warning sign is shortness of breath, medically known as dyspnea. This often goes hand in hand with the unusual fatigue we just talked about. Your heart and your lungs work together in a very tight partnership. Your lungs bring in oxygen, and your heart pumps that oxygen-rich blood to the rest of your body. If your heart muscle is starting to fail or is not getting enough blood flow due to a blockage, it cannot pump effectively. This causes a backup of pressure in the veins that lead from your lungs to your heart. Fluid can even start to leak into your lungs, making it incredibly difficult to breathe. You might find yourself gasping for air while simply walking across the living room or feeling like you cannot get a deep breath, even when you are just sitting still watching television. Many people ignore this, thinking they're just out of shape or maybe fighting off a small chest cold. But if you find yourself struggling to catch your breath during activities that normally would not bother you at all, this is a massive red flag. Your body is telling you that the heart-lung connection is under severe strain. Moving on to the third sign, which is something many people misdiagnose themselves with, and that is severe indigestion, heartburn, or stomach pain. It is extremely common to brush this off as just something you ate. You might think that spicy meal from last night just did not agree with you, but the nerves in your stomach and your heart are very closely connected and run along the exact same pathways to your brain. When your heart is struggling and crying out for oxygen, your brain can misinterpret those pain signals as coming from your stomach. This pain can feel like a heavy burning sensation in your upper abdomen, and it might be accompanied by nausea or even vomiting. What makes this so incredibly dangerous is how easily it is dismissed. Millions of people have popped an antacid thinking they just had heartburn, completely unaware that their heart was actually in extreme distress. The key difference here is how the pain behaves. If the burning sensation or nausea comes on suddenly, feels unusually severe, is not relieved by typical stomach medications, or gets worse when you exert yourself physically, you must not ignore it. Your stomach might feel fine, but your heart is the one actually suffering. The fourth symptom involves pain or discomfort in areas other than your chest. We are conditioned to think a heart attack only hurts in the center of the chest. But remember how we talked about the nerves sharing pathways to the brain? Because of this complex nervous system, the pain from a struggling heart can radiate outwards. This is called referred pain. One of the most common areas to feel this is in your left arm. The pain might start in your chest and travel down the arm, or it might just appear in the arm alone as a dull ache or a heavy numb sensation. But it does not stop at the left arm. You can also experience this warning sign in your jaw, your neck, your back, or even between your shoulder blades. Jaw pain is especially common in women experiencing early heart attack symptoms. It might feel like a tightness or a dull ache in the lower jaw that gets worse when you walk or exercise and gets better when you rest. Back pain, specifically a deep ache between the shoulder blades, is another huge warning sign that gets dismissed as a pulled muscle. If you have sudden, unexplained pain in any of these upper body areas that does not seem related to a physical injury, your heart is sounding an alarm. The fifth warning sign is cold sweats and sudden dizziness. Imagine you are sitting in a perfectly cool room, you are not exercising, and suddenly you break out in a cold, clammy sweat. Your skin feels cold to the touch, but you are sweating profusely. This is your nervous system reacting to a major physical stressor. When your heart struggles to pump blood, your blood pressure can drop suddenly. This lack of adequate blood flow means your brain is not getting the oxygen it needs to function properly. As a result, you might feel extremely dizzy, lightheaded, or even feel like you are going to pass out. Your body goes into a fight or flight response because it senses a severe drop in blood volume, triggering that cold sweat. This combination of breaking into a cold sweat while feeling completely lightheaded is a classic textbook sign of an impending cardiac event. It is a terrifying feeling, and your instinct might be to just lie down and wait for it to pass. But lying down does not fix a blocked artery. This is a critical moment where your body is warning you that a major system failure is trying to happen. The sixth early warning sign is an irregular or unusually rapid heartbeat, often referred to as palpitations. Now it is completely normal for your heart rate to go up when you are exercising, when you are incredibly excited, or when you are very frightened. But if you are just sitting on the couch reading a book and suddenly your heart feels like it is racing, pounding against your chest wall, or skipping beats, that is a serious cause for concern. This happens because the electrical system of your heart is being disrupted. When blood flow is restricted due to narrowed arteries, the heart muscle cells become irritated and unstable. This irritation causes them to misfire electrically, leading to these strange rhythms. You might feel a fluttering sensation in your chest or a sudden hard thumping in your neck. If these palpitations last for more than a few minutes, or if they are accompanied by any of the other symptoms we have discussed, like dizziness or shortness of breath, it means your heart is struggling to maintain its normal, healthy rhythm under the stress of restricted blood flow. The seventh and final early warning sign is a feeling of intense anxiety or a sense of impending doom. This one is entirely psychological, but it is deeply rooted in physical reality. Many survivors of heart attacks report feeling an inexplicable, overwhelming sense of panic or dread in the days leading up to the event. They just feel that something is terribly wrong, even if they cannot pinpoint exactly what it is. This is not just everyday anxiety. This is your brain responding to the subtle distress signals coming from your struggling heart. Your body knows it is in danger before your conscious mind can make sense of the physical symptoms. If you suddenly feel a crushing sense of dread or anxiety that comes out of nowhere and you cannot attribute it to anything specific in your life, you need to listen to that gut feeling. Your intuition is powerful, and when it is paired with any of the physical signs we just covered, it is a massive final warning bell. Recognizing these 7 early signs is only the first part of the equation. Knowing what to do when you or someone else experiences them and understanding exactly what causes this plaque buildup in the first place is what will ultimately save your life. To truly protect yourself, we have to look inside the arteries and understand why they become blocked in the first place. Imagine the plumbing in an old house. Over decades, minerals and rust can build up on the inside of the pipes, making the space for water to flow much narrower. The exact same process happens inside your body. Pipes are your coronary arteries, which are the blood vessels that wrap around the outside of your heart and supply it with the oxygen it needs to beat. The rust and buildup is a sticky substance called plaque. This plaque is made up of cholesterol, fat, cellular waste products, calcium, and a clotting material in the blood called fibrin. When you have high levels of bad cholesterol floating around in your bloodstream, along with high blood pressure pushing forcefully against the artery walls, little microscopic tears can happen inside those blood vessels. Your body sends cholesterol to patch up those tears, but over time it accumulates and hardens. This slow, silent process can start when you are in your 20s or 30s, and you will not feel a single thing until the blockage becomes severe. This brings us to a crucial point about how our daily habits accelerate this buildup, specifically focusing on the worst breakfast for your heart. Breakfast is often celebrated as the most important meal of the day, but millions of people across the United States, Australia, the United Kingdom, and Canada are actively damaging their arteries before they even leave the house in the morning. Think about a typical traditional breakfast plate loaded with processed meats like bacon and sausages, paired with white bread toast slathered in margarine, or highly processed sugary cereals. Processed meats are incredibly dangerous for your heart health. They are packed with sodium, which spikes your blood pressure immediately, forcing your heart to pump harder. More importantly, they contain chemical preservatives like nitrates, which cause massive inflammation in the blood vessels. Inflammation is the fire that causes cholesterol to become trapped and harden into plaque. Sugary cereals and refined carbohydrates like white bread digest instantly into sugar, spiking your insulin levels and triggering your liver to produce more bad cholesterol. If you start your day like this, you are providing your body with the exact building blocks it uses to clog your arteries. Now, what actually happens on the day a heart attack strikes? The plaque we just talked about has a hard outer shell and a soft, mushy inside. Sometimes, due to high blood pressure, extreme stress, or severe inflammation, the hard outer shell of that plaque suddenly cracks open or ruptures. When this happens, the soft, fatty contents spill out directly into your bloodstream. Your body views this sudden rupture as an injury, exactly like if you had just cut your finger with a knife. Body instantly sends blood cells called platelets to the area to form a blood clot and stop the perceived bleeding. But inside a tiny, already narrowed artery, this blood clot is a disaster. The clot grows rapidly and can completely block the entire artery in a matter of minutes. When the blood stops flowing, the heart muscle cells that rely on that specific artery for oxygen begin to suffocate and die. This is what a heart attack actually is. It is not just the heart stopping. It is a portion of the heart muscle actively dying due to starvation of oxygen. If you or someone around you ever experiences the warning signs we discussed earlier, especially if they escalate into sudden, crushing chest pressure, pain radiating down the arm, and extreme shortness of breath, you must take immediate action. The absolute worst thing you can do is lie down and wait to see if it goes away. Time is muscle. The longer the heart goes without oxygen, the more permanent the damage becomes. The very first step is to immediately call emergency services. Do not try to drive yourself to the hospital, and do not let a friend or family member drive you if an ambulance is available. Paramedics have specialized equipment and medications in the ambulance that can start saving your heart muscle the second they arrive. While waiting for the ambulance, if the emergency dispatcher advises it and the person is not allergic, chewing a standard aspirin can be incredibly helpful. Aspirin thins the blood and helps prevent the blood clot from growing larger, which can buy precious minutes until you reach the emergency room where doctors can physically open the blocked artery using a stent or clot-busting medications. The wonderful news is that your body is incredibly resilient, and you have massive power to reverse this damage and clean out your arteries naturally. Let us shift our focus to the absolute best foods to unclog your arteries and heal your heart. If you want to start your morning right, replace the processed meats and sugary cereals with a simple bowl of plain whole grain oats. Oats contain a very special type of soluble fiber called beta-glucan. Think of beta-glucan as a sponge that travels through your digestive tract. It literally binds to cholesterol in your gut and pulls it out of your body before it can ever reach your bloodstream to form plaque. Adding a handful of fresh berries, like blueberries or strawberries, to your oats provides a massive dose of antioxidants called anthocyanins. These antioxidants act like a fire extinguisher for your blood vessels, lowering the inflammation that causes plaque to rupture in the first place. For your main meals, you need to prioritize fatty fish like wild-caught salmon, mackerel, or sardines at least twice a week. These fish are swimming in omega-3 fatty acids. Omega-3s are perhaps the most powerful natural medicine for your heart. They dramatically lower the level of triglycerides in your blood, reduce irregular heartbeats, and slow down the buildup of plaque. If you do not eat fish, incorporating a high-quality fish oil supplement or eating plenty of walnuts and chia seeds is essential. Alongside healthy fats, your plate should be piled high with dark, leafy green vegetables like spinach, kale, and Swiss chard. These greens are packed with dietary nitrates. Unlike the harmful chemical nitrates added to bacon, natural dietary nitrates from vegetables are converted by your body into nitric oxide. Nitric oxide is a miracle molecule that signals the smooth muscle inside your blood vessels to relax and open up wide. This instantly lowers your blood pressure and ensures maximum blood flow to your heart muscle. Finally, protecting your heart is not just about what you eat. Your daily habits play an equally massive role. Your heart is a muscle, and just like your bicep, it needs to be exercised to stay strong and efficient. You do not need to run marathons to achieve this. Just 30 minutes of brisk walking every single day is enough to dramatically lower your risk of a heart attack. Walking encourages your body to build tiny new blood vessels, creating alternative routes for blood to reach your heart in case a main artery ever does become blocked. Furthermore, you must prioritize your sleep. When you do not get at least 7 to 8 hours of quality sleep, your body remains in a constant state of low-level stress, elevating your blood pressure and keeping your heart working in overdrive all night long. Combined with managing your daily stress through deep breathing or spending time in nature, these simple lifestyle adjustments create an environment in your body where plaques simply cannot survive. Your heart beats around 100,000 times a day, never taking a single vacation. It is entirely up to you to give it the care, the fuel, and the attention it deserves. Listen closely to the subtle whispers your body sends you before they turn into screams. Eat foods that heal rather than destroy. Move your body daily, and never ignore a symptom just because it seems inconvenient. You have the knowledge now to take control of your cardiovascular destiny. Thank you for dedicating your time to learning about your health today. If you found this information valuable, please make sure to apply these tips to your daily life and share this with your friends and family so they can protect themselves too. Stay healthy, stay proactive, and take care of your amazing heart.